Hello, I'm Abdullah from Saudi Arabia. Today I have Dr. Robert with me to answer some common question regarding ABA in Saudi Arabia. Dr. Bob, can you introduce yourself, please?
Sure. My name is Dr. Robert Ross. I'm the Chief Clinical Officer for Beacon ABA Services in Massachusetts. I've been a practicing behavior analyst for about 33 years. And I've been working with a range of populations, but primarily children on the autism spectrum with learning and behavioral challenges.
Thank you. In Saudi Arabia, there is a lot of people, they don't believe that you need to be certified in to practice ABA. So, do you think people need to be certified to practice ABA with the kids with autism? So why?
Well, let's take that two ways. I was a practicing behavior analyst before there was such a thing as certification. Certification came about in the year 2000, and I got certified in 2001. I practiced ABA before that. That said, today it is really critically important that we make sure that, particularly if I'm a parent or a government agency paying for services, I need to make sure that I know that the person who's providing those services has had formal training in applied behavior analysis, has done clinical work and practiced as a behavior analyst under the supervision of a competent behavior analyst, and the best guarantee of that is certification by the Behavior Analyst Certification Board, having the BCBA credential. People without that credential may or may not have had formal training, probably did not complete the 1,500 hours of supervised field work experience under a competent behavior analyst. There are exceptions. There are some people who've worked for 30, 40 years and did not pursue certification. But if you're anywhere from 20 to 50 years old today and you are doing this work, you should have that credential. It is essential as a guarantee for parents and consumers that you've had formal training. People who claim to have that training often have not. There's an extensive history of people claiming to have training in ABA who don't, and quite frankly have had training that is against behavior analysis. Much of psychology attributes learning and behavioral differences to things inside the individual, inside their head, where ABA talks about those causes in the environment and analyzes how the environment affects learning and behavior. People who claim ABA training often have not had formal training in behavior analysis and have a perspective that's different and going to make them do things inconsistent with applied behavior analysis. The credential is the best guarantee that you have someone who's had the correct training.
Sure. Thank you so much. So I have another question regarding can you tell me please what's the difference between ABA and behavior modification? So because a lot of people recently they are trying to mix them together. Yeah. So can you please clarify that?
Well, the field of applied behavior analysis started as essentially a field of behavior modification. And I always like to use the sort of analogy that it's really the difference between understanding science and applying basic procedures. So for instance, for someone who's to be a good mathematician, they have to understand addition, subtraction, multiplication, algebra, geometry, trigonometry, complex math. And so that's the analogy, that's the science of applied behavior analysis. They have to understand all of the principles in science that make up that field. Behavior modification is just being taught addition. You know one set of procedures, but not really the breadth and depth of the science. So the field has evolved from behavior modification to applied behavior analysis, recognizing the complex understanding of learning and behavior and all of the scientific principles that undergird that learning and behavior. So if someone says they do behavior modification, look at them as people who their full bucket of tricks or basket of skills is they can do addition, versus a behavior analyst with formal training and expertise who really has the breadth and depth of how to do math, how to understand, how to teach and to acquire mathematical concepts. Big difference in terms of skill set.
Okay, thank you so much. So a lot of people just keep saying Skinner is not BCBA, Cooper not BCBA. So how can you answer this question? Is there if they ask you about that, exactly saying like he's not BCBA, so why you want me to go to like try to be certified in this field? So,
Well, the sort of silly question. B.F. Skinner died in the early 1980s. Before certification existed. He couldn't become a BCBA. There was no such thing as a BCBA. He invented the science and practice of behavior analysis and much of the measurement and procedures we use. He couldn't be a BCBA because there was no such thing as the Behavior Analyst Certification Board while he was alive. Now there are people like Cooper, Heron, and Heward, authors of the White Book, the primary text that's often used in our field. These are gentlemen who teach in university settings. They don't do intervention with children with autism. And that credential is designed to differentiate people who have a formal credential, who are using that credential in the application of the science. As a university faculty, you don't need certification to do your job. So many of them have not pursued it. However, if you're going to teach a child on the autism spectrum and claim expertise and training in behavior analysis, that credential is the best guarantee. If I'm a parent and I want to know, do you have formal training? That credential tells me that you've actually been through an academic program, that you've passed a rigorous test, that you've completed hours and hours of field work. I have some guarantee that you can do this work, where I don't have that if you don't have that credential. So can there and are there people out there who don't have that credential, who have credibility as behavior analysts? Yes, but not ones doing intensive treatment with children on the autism spectrum. That's a credential that there are very few people in existence who have the depth and expertise who don't have the credential. There may be 5 in the world that I would say have that expertise who don't have the credential. But today, in this day and age, if I'm a parent, I don't know that that person does have the expertise without the credential.
yes, that's true. Thank you so much. So, why you think it's important in ABA to be recognized in Saudi Arabia?
Well, the science of behavior analysis, to be recognized, probably needs Saudi Arabia to recognize the credential of applied behavior analysis, the Behavioral Certification Board. There's been a tremendous impact of having that credential in the United States. Families and children, and there are a lot of them that are seeking quality ABA services, didn't have a lot of people to provide those services back 10, 15 years ago. But when the credential came about, and was recognized, particularly with insurance, all of a sudden training programs emerged, people started valuing credentials, so they went to get formal education, and now parents and children have greater access to services. There are, I think you said, 18 BCBAs in all of Saudi Arabia.
Yeah, around this number, yes.
Yeah, that is nowhere near enough to meet the need of children who need quality services. If you recognize the credential, then people will seek that credential out, and you'll have people who have the training and expertise to provide quality services. This is one of those, you need to build it so that people will come. If you don't recognize the credential, people won't get it. Parents then don't have access to services. The absence of accepting that credential in the Kingdom of Saudi Arabia is a barrier to children and families getting quality services. It is really critical important that the government recognize that credential and support the development of verified course sequences and academic programs, making that available. Once that happens, the number of people seeking the credential and the number of children and families being able to access high-quality applied behavioral treatment services will increase, and will increase relatively quickly. We saw here in Massachusetts, in the course of really 5 or 6 years, going from 700 behavioralists to over 2,000, nearly 3,000. We have 17 training programs in the state because it's a valuable credential. When the state accepts it, when people recognize its value, what you have is then people seeking the credential out, and that leads to access to services. Absent that recognition, people don't seek the credential out, and there aren't competent and qualified training people to provide the services. And that just means families have to wait, or they have to leave the kingdom to go find those services. And that is not something I think in the long term you as a country want to have happen. You want to be able to have people access services from trained professionals within the kingdom by trained professionals in the kingdom.
Thank you so much, Doctor.
My pleasure.
For your time. Thank you so much.
Thank you.
All right.